The statistics are alarming. Every year, more than 140,000 people die from stroke. It's the fifth leading cause of death in the U.S. The faster a patient gets medical attention, the less likely they will experience lasting damage or death. For communities with certified stroke centers, that emergency medical care is close to home.
It's important to take action quickly because the sooner you get a diagnosis and the sooner we treat you, the more likely it is for you to have a good recovery. People who arrive to the hospital quickly after stroke begins are eligible for acute stroke care. Acute stroke care now includes giving medication that can act as a clot buster.
Now, Pelham Medical Center has joined an elite group of providers focused on complex stroke care, receiving the primary stroke certification from the Healthcare Facilities Accreditation Program. This certification designates Pelham Medical Center as being Greer's first certified primary stroke center. This designation certifies that Pelham Medical Center is an industry leader, having the teams, technology, and protocols in place to provide the most specialized stroke care in the region. The staff at Pelham Medical Center is ready to deliver the same fast and complex care as any primary stroke care center to any person suffering an acute stroke, all the way through to recovery.
We work with neurologists, we work with occupational therapy, physical therapy, lab, imaging, guest services. I mean, there is almost every entity that a stroke patient doesn't touch just because it's such a debilitating illness. You know, there's from the onset of ER arrival to PT and physical therapy when they're discharged. So there's a lot of stuff that goes into a stroke patient and the care at the beginning and as they leave the hospital.
Stroke centers have quality guided protocols and processes in place to allow rapid identification and timely treatment of stroke, which helps reduce disabilities. This includes certain time limits to get treatment started.
Any patient that arrives at a primary stroke care center can get all of the stroke care that they need at that center. They're able to get all the highest level of care right at that hospital, and they can be admitted to the hospital and cared for there by people trained specifically in stroke care. Their families can visit them there. They don't need to travel. They don't need to be sent off to a larger hospital.
With an ischemic stroke, which is a blood clot that has blocked off an area, a blood vessel in the brain, so you're losing oxygen to part of your brain. So us being here in Greer, the next hospitals are both 20 to 30 minutes away. We want to get that medicine that can bust that clot up as quickly as possible to those patients.
If patients do not seek care immediately at the time of stroke onset, they're not eligible for the kinds of treatments that can restore their function much better and much faster. Those treatments are not available if you arrive at the hospital more than 3 hours after onset of stroke.
The message of stroke treatment remains urgent: to act fast. F is facial weakness. A is arm weakness. S is speech, slurred speech. T is time. It's time to call 911.
By having the primary stroke center here and being able to provide a full range of care for these stroke patients, we have elevated the care of for stroke patients in Greer, and that is a tremendous benefit to have a stroke center that's close to you.
A commitment to providing the very best stroke care, working with the community to offer fast, effective treatment leading to significantly higher chances of recovery at Pelham Medical Center.